Okay, for this section on pigs, we're going to look at some of the common tasks you might find yourself either performing or helping someone else to perform with relation to this species. So, if we start off with newborn piglets, a common job you might have to do is give them an iron dextran injection. Pig's milk is low in iron, like that of all mammals, and normally baby pigs will ingest iron from the soil and from their environment, but if they're being kept indoors, they won't have the access to soil to do that. If they do become iron deficient, they'll get anemia and they get weakness and breathlessness, and often it's called the baby pig thumps because they get a very loud, rapid heart rate due to the anemia. So if you have clients who are keeping pigs, say, in concrete pens, you would recommend to give them iron dextran. If they're living outdoors, they probably get away without it. The solution is available. It's sterile iron dextran solution. You give 150 to 200 milligrams into the neck muscles as a once-off injection in the first 3 days of life. A sort of a 20 gauge 1-inch needle will normally do the job. And if the animal is on creep feed that's low in iron and doesn't have access to soil, you could repeat it at week 3. But in most cases, a once-off injection is enough. The other thing with baby piglets is they're born with very, very sharp so-called needle teeth in their mouth, and they'll try and nurse anything that they encounter. And they also fight. We mentioned that they'll compete for the best feeding positions on the sow, so they may injure each other and the sow's teeth. So for this reason, most commercial farms will clip newborn piglets' teeth. So you need a special tooth clippers for this, because the pliers should be clean and sharp and disinfected between each piglet. You're trying to remove the distal half to 2/3 of the tooth, leave the teeth intact and close to the gum line so you don't cause the animal any discomfort and you reduce the risk of broken or infected teeth. The procedure is well tolerated, so providing you're not cutting off too much of the teeth, you don't need to provide any analgesia or special aftercare. You pick up the piglet and open their mouth by gently but firmly pressing on the corners, and then when they open their mouth you can put the clippers against their teeth. Another common procedure is tail docking. Piglets have a habit of chewing each other's tails. They may continue to do so after weaning, particularly if the pigs are stressed, and this can lead to tail injuries and infections. This can also give rise to spinal abscesses, and the animal develops hind limb paralysis, and that's irreversible, so it's a welfare problem. If the pigs are in a environment where they can exhibit normal behaviour and they aren't stressed, they're less likely to tail bite, but that's difficult to fulfil on most commercial units. Keeping them in the same group all the time helps because they know each other, but in general it can be a problem. So for this reason, most commercial piglets have their tails docked at 1 to 2 days of age. For outdoor pigs, they're usually in a lower stocking density and they've more to keep themselves occupied, so it's rarely necessary in outdoor pigs. In terms of castration, if clients are rearing commercial pigs for slaughter, they'll reach their finishing weight before they're sexually mature, so you don't have to worry about castrating them. But once they reach puberty, boars will produce those pheromones we mentioned, which puts this unpleasant smell on their meat called boar taint. Also, we mentioned boars are aggressive and can cause injury with their tusks, so we'd recommend that male piglets that are not going to be slaughtered at a young age should be castrated. If you've got traditional breeds, they grow more slowly as well, and often they'll reach puberty before they're ready to slaughter. So from a meat quality point of view, it's recommended to castrate them as well. The procedure is done, it's surgical castration under local anaesthesia, so it's best performed by a vet when the animal's about 1 to 2 weeks of age. So if you have clients who are having litters of pigs, it's worth thinking about this and scheduling an appointment to carry out the procedure when the piglets are about 2 weeks old. You can do other surgical procedures on pigs, they're not very common. Hernia repairs and caesarean sections are probably the main ones. Chapter 26 in Large Animal Clinic Procedures for Vet Technicians will talk you through those if you need any more detail on them. I'm not going to go into them here. So, that's it on pigs for the moment. If you have any further questions on them, please feel free to pop them on the Moodle forum for me and I can answer them for you. They're a nice animal. I think they often don't get enough credit. I've always enjoyed working with them, and if you have clients who have them, they can be very enjoyable animals, but it's important to make sure that you're well enough informed to be able to give clients good advice and help them keep the animals in the best possible condition. Okay, thanks.